Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hardworking Americans and their families? You will. This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefit in benefit plan. Now prepare to learn, plan, save, and protect with the FIA Group.
All right, welcome everybody to the Empowering Plans Podcast. My name is Nick Bonds, and with me again here today is my traditional partner in crime, Corey Krieger. How you doing today, Corey?
Nick, doing great. Feels like it's only been a few weeks since we did a podcast together, but since then I've added 2 new additions to my family, and so it certainly has felt like years since we have talked to each other, at least based on my sleep schedule. But happy to be here and happy to be part of the podcast today.
Yeah, those twins, man. I do not envy you right now. Do they like to do everything together, or do they tag team you, where one will wake up and cry, and then as soon as you get that one down, the other one's rearing to go?
It's comical sometimes when it happens that way. I will say overall, they are our easiest 2 children that we have. Child 3 and 4 are pretty easy. But there are situations in which it just is comical. You'll spend 30, 45 minutes consoling one and getting them squared away, and then the other one fires off. Or my favorite is when we just have dirty diaper after dirty diaper after dirty diaper consecutively. It's like they're out to get us, and they're playing a joke, and we're the losers. So, but we enjoy it.
Yeah, you love them. You do. I can tell. Mm-hmm. All right, we've got a few exciting topics to hit on today. We've got a couple quick updates that we wanted to start off with. I know one of the big things that we saw at the beginning of this week was an announcement from the Biden administration that they were going to be winding down the emergencies, sort of an emergency declaration about the emergencies. The national emergency, just as a reminder, this is the one declared by the president and ties to the tolling of timeframes during the COVID-19 outbreak period. So the national emergency established the outbreak period during which a lot of different important aspects of the plan, things like special enrollments, COBRA notices, COBRA premium payments, claim filing and appeals deadlines, all of that effectively had a 1-year extension built onto the front end, whereby they had to run down that full year before the normal timeframes could start to wind down. The national emergency outbreak period will extend about 60 days past the national emergency itself, which means the national emergency and the public health emergency are both set to wind down May 11th, but the outbreak period won't be gone until 60 days after that. So mid-July, all of the normal timeframes and tolling will all sort of be back to square one. The public health emergency, meanwhile, this was declared by the Secretary of HHS. When that winds down, that'll mark the end of the extra group mandates for covering COVID-19 testing and vaccines. So plans will have a little bit more latitude once that winds down to impose their standard cost sharing on out-of-network providers providing those sorts of things. A lot of the vaccines themselves will probably still be covered under the standard preventive care mandates the group health plans have to abide by, but they will have at least a little bit more flexibility once all that winds down. Again, both emergencies currently are slated to wind down May 11th. I think that this announcement was made sort of in response to some saber rattling on the House trying to end the emergencies immediately. I think there was some discussion on the Hill that Congress was trying to pass legislation that would terminate those right away. This is sort of a way of extending them just a little bit further. But right now, the plan seems to be that both emergencies will wind down May 11th. That could get pushed back, that could get pushed up, but we're going to keep our eyes open and see how it goes. But in the meantime, just beware, the national emergency and public health emergencies look to be winding down. And I know, Corey, you had some updates from your neck of the woods you wanted to listen to.
Absolutely. And I know that this is an interesting time. I can't remember when you started, Nick, but I was hired December of 2019. So I worked at FIA for about, 45, 50 days before the restrictions and COVID really got started. So this is kind of a surreal topic to start out with because it's kind of the only life I've known since I've been at FIA is a life of emergencies within our emergencies. I'm sure you guys will get inundated on the consulting side with all kinds of questions about COBRA, about coverages, and I'm sure we're well equipped to handle that. But to me, this is just an interesting sea change, and maybe I can work at FIA for a little while with no national emergencies looming overhead. That'd be a nice little change of pace.
But what a world we'll live in, right?
Absolutely. Yeah. And, speaking of rumblings from legislatures, I was talking with a client earlier this week, and we were discussing a House bill that we're keeping an eye on out of Indiana. It was Indiana House Bill 1004, for those of you who are interested in state legislature as it pertains to cost containment. It's an interesting bill in that it actually provides that if a nonprofit hospital charges on average more than 200% of the federal Medicare reimbursement rate for health services, then the Indiana Department of Health can levy a fine against these nonprofit providers. So breaking that down, and what does it mean and why do I think it's so important to highlight? Obviously, with my emphasis and my job in the FIA group being revolved around balanced billing, some RBP plans, we've been fighting this good fight of bill charges being out of control, not being tied to any metric for a long time now. And we're finally starting to see some movement locally in that seems to be trending towards the direction that we've been right all this time, that bill charges aren't tangibly related to anything, and that we need to start tying bill charges to an objective metric like Medicare, or providers are going to start facing penalties. So it's in its infancy. It was just read on the House floor in Indiana. For those of you who don't know the Indiana political structure, Republicans have a supermajority in both the House and Senate in Indiana, and it is a Republican governor. This was a bill introduced and drafted by the Indiana Republicans as well. So it has a high likelihood of being successful, but just something that we're keeping an eye on. It's in its infancy, but we do love to see these developments and want to keep everyone out there in podcast land informed on things that we find interesting within the industry. So that's my current event topic before we get into the heart of the matter that we kind of planned on talking about, Nick.
And Corey, you said that at least in its current form, that fine would only apply to nonprofit hospitals.
Yeah, this is specifically for 501c3 nonprofit hospitals. So not applying to your for-profit hospitals, but certainly a tool for your 501c3 nonprofit providers. Yeah. And it would not even go into effect until 2025. So you have a runway here. It's a piece of 2023 legislation with quite a long runway before it would go into effect.
All right, so it's on the ways off on the horizon, but that is an interesting development. We'll definitely have to follow up on that one, see where it goes.
Absolutely.
All right, some other interesting developments that we see. Some of the legislation that we saw come out of the federal government at the end of last year actually pushes out some other deadlines that we were concerned about to about 2025, I think. So one of the big developments during the pandemic had been the expansion of flexibility for HSA qualified HDHPs, your health savings accounts, high deductible health plans, some expanded flexibility for those to cover telehealth coverage. Now, kind of going back to first principles as a refresher, the general rule with the health savings account is that you have to be enrolled in a high deductible health plan, and you can't get any benefits prior to satisfying your high deductible health plan's deductibles. So a lot of HSA qualified HDHPs would run into a problem where they offered a telehealth benefit because the telehealth would generally cover things that went beyond preventive care. So if they were covering anything before the participants were satisfying their HDHP deductible, they could wind up disqualifying themselves from being able to contribute or have their employer or whomever contribute on their behalf to their HSAs. During COVID, Congress sort of loosened up the rules on these in the CARES Act and then expanded on it in the CAA and made it possible for these plans to provide pre-deductible telehealth coverage without compromising their HSA eligibility, which was a big deal, especially during a pandemic where it's not as necessarily as safe to go in to see your doctor in person or to go into a hospital setting. So telehealth's made a lot of sense. And I think in the intervening time, a lot of people really embraced it. We saw a lot of uptick in people utilizing telehealth programs. We saw a lot of people getting their prescriptions through telehealth programs. It's a lot easier to get a prescription if you can call up your doctor and have a video chat than having to schedule an appointment and go into an office. So this was really great, and it saw a lot of uptake. Problem was that even under the CAA expansion, that was all going to come to an end at the end of 2022. But in the new Consolidated Appropriations Act, the CAA 2023, they passed a further extension of that requirement. It's no longer tied to the pandemic. It just gets an extension through the end of 2024. So effectively, plan years beginning on January 1st, 2023, on or after January 1st, they'll be able to continue providing that first dollar coverage of telehealth benefits without making it impossible for their participants to utilize their HSAs. There is kind of an odd quirk there for plans that aren't operating on a calendar year, because it's specifically its effect for plan years beginning on or after January 1st. So if you're on a non-calendar year plan that doesn't start until a couple of months into the new year, that brief window between the end of 2022 and whatever your new plan year kicks off, they won't be able to utilize that safe harbor. But going forward from there, it should offer a lot more flexibility for group health plans. It's sort of especially exciting because this is one of those things that we just saw getting continued and continued during the pandemic, and it seems to really be taking hold. So there's some chance, at least, that this could continue beyond that end of 2024 deadline. There's a lot of rumblings that this could be made permanent or at least extended further. So that's kind of exciting to think about, that, these rules are getting loosened up bit by bit, could help a lot more people. I'm sorry, I was going to let you cut in there, Corey.
No, it's great. And what I was going to say, Nick, is I love the topic that we kind of landed on for this podcast, because telehealth here, then we're going to talk a little bit about Amazon in just a minute, but it feels like what we're talking about is right on the cutting edge of just a sea change in the way that we think about healthcare. I think that we are right on the cusp, and telehealth has obviously been on the rise for the last couple of years, but the pandemic kind of shed light, as you mentioned, on when it is safe to be around other people. But the factor that we're dealing with right now, just the convenience factor. Since the twins have been born, they were born late last year, my two older children each had the stomach bug. So we're having newborn appointments. We're having take older kids to the doctor. My wife is having follow-up appointments. I get a head cold all within the span of 5 or 6 weeks. And just the logistics of getting physically from point A to point B, when sometimes I just need to pick up the phone and say, Doc, is there anything I can do for my daughter's nausea? Doc, is there anything that I can do for this head cold, or am I just going to have to waste it out and not have to pack up a kid or split kids up? Yeah, it just feels like we're on the cusp of a big change in the way that we traditionally think about medicine, how medicine is practiced, how you intake healthcare, the way you think about healthcare, the way you think about your data. And we're right on the cusp of maybe a brave new frontier. And I think telehealth is kind of the forerunner of this. And Amazon obviously sprinting to the front, or at least trying to leverage their tech and their data collection into preventative medicine. And that's a seamless segue to hand it back to you, Nick, so we can set up and talk about what Jeff Bezos is doing and what moves Amazon is making in the digital health space.
Yeah, Amazon is making some noise. Over the years now, they've made a few different moves, a few different forays really into the healthcare business. And I'll admit, I was initially pretty skeptical. I thought it was interesting that they wanted to leverage their technology and their position in the industry, their infrastructure, to kind of shake up the healthcare system. But when they launched Haven back in 2018, it was not a resounding success. It didn't go very far, but they've made a few other moves since then. The most recent move was their announcement of RX Pass. And this is pretty interesting, actually. If you have a Prime subscription, I've kind of explored it a little bit myself. You can go to their site, you can add this on as an option. It's, I think, a $5 add-on to your Prime subscription. And it basically allows people to get virtually, it seems, unlimited shipments of prescription drugs from Amazon Pharmacy, which was one of their earlier moves from, I think, 2020. Basically, you talked, Corey, about the convenience factor. When one of your kids has a sore throat or a runny nose, you can have a teleconference with your doctor and get a prescription. And theoretically, you could go into your Amazon app and order a generic from the RX Pass from RX Pharmacy and get unlimited shipments of whatever prescriptions you needed to treat that right to your door, which is kind of mind blowing from a convenience standpoint and just from a facilitation of care standpoint. I think that's one of the issues a lot of doctors have talked about with their patients, especially patients that need ongoing medication, people that need regular prescription drugs. One of the biggest factors that causes speed bumps in their care is not being able to conveniently get a prescription, not being able to conveniently or affordably fill that prescription. And companies like Amazon, with all of their resources, being able to put out a tool like this, I think that could help a lot of people hopefully save money, hopefully help their health plan save money. Because remember, in general, preventing a disease is a lot less expensive than treating a disease. And consistently and systematically treating a disease is always going to be healthier than a stop and start approach. So the easier people can get their prescriptions, the easier people can maintain a course of treatment and satisfactorily, hopefully complete a course of treatment, the healthier they're going to be and the less expensive they're going to be for their employer's health plan.
Yeah, when I was doing some research on that Amazon RX, there were some points I thought were interesting. So it's not going to be an exhaustive source for any medication that you could think, right? They started off limiting medications that cover 80 common health conditions. And some of the examples that they gave were high blood pressure, hair loss, anxiety, acid reflux. So some of your run-of-the-mill common prescriptions. But in the press release that I read, they did say that the combination of prescriptions that they have available, over 150 million Americans are taking at least one or more of the drugs offered. So you are covering a vast majority of the population, even though it's limited in scope. They're going after kind of the low-hanging fruit, so to speak, in common health conditions. And then the other thing that I really want to think about, and maybe it's more of a thought experiment than it is of being able to provide actual substance on it. But if you think about the Amazon kind of goal and the way they're positioning themselves in the market. So Amazon Clinic, they're an online-based healthcare service that are also offering treatments where you can select a condition, you can do an intake questionnaire, you automatically get connected with a clinician, and then you can get your RX, and that can be filled at a pharmacy of your choosing. Or if you are a Prime RX member, it can then be shipped directly to your house within 24 hours. So Amazon is moving to one-click submission, treatment, and subsequent prescription being sent to your door, all through the convenience of an Amazon product or app. And then their other big goal that I was reading is they're really wanting to break into the primary care space. And it is, at least their altruistic talking points, are what you just hit, Nick, that preventative medicine is far less expensive. So if Amazon can look at your fitness habits, if they can look at your daily activity habits through your myriad of devices that are inside your home, your cell phone, your Alexa, your watch, your car, and they can see your risk pattern, they can see your diet, they can see your physical condition, and they have access to your family history medical data, and then coordinating a care plan for you that can kind of get ahead of the most likely diseases that you may face in your life. That is their overall goal. And that's, probably a 40-year plan, but that is what they're looking to do, is to revolutionize what preventative care is in our mind. Right now, I still think, kind of like what I was saying about telehealth, it feels like it's in its infancy. Preventative care now is eat right, no carbs after 6 p.m., right? Whatever fad diet of your choice is, get some good cardio, get some sunlight, and you want to take care of yourself. But how can Amazon leverage the billions of data points it has, and can it create comprehensive healthcare plans that prevent diseases that are ravaging the populace? I think it's a super interesting question and maybe one for some ethical conversations, but it certainly sounds like a noble endeavor, and I'm interested to keep an eye and see where that goes. So any thoughts on that, Nick? I know that's a lot right there to unpack in a very short podcast. The big data collection, what do you think?
No, it is wild to think that that could be the future. It's sort of already kind of mind-boggling that all through essentially the same app, you can go in, talk to a doctor, get a prescription, get that prescription filled, watch an episode or two of Ringer Power, and get that prescription delivered. And that means that through all of this, a single company would effectively have, so many different types of data on each person, not just your watch history, not just your purchase history, but a significant access to your medical history as well. That's a little terrifying. It is sort of exciting, just the convenience factor and the potential that this has to hopefully help a lot more people access a lot more necessary medication. But it'll be interesting to see how things like HIPAA might start applying to a company like Amazon, and in what context and what sort of protection that might actually meaningfully provide in a world where everything's happening through a single app. But I think we can take a step back from that terrifying precipice and just say that this is a really fascinating development. I think we have some exciting things coming out of it, but definitely things to keep an eye on. What do you think, Corey?
I think that I'm going to get out in front of everyone and say, you know what? Not bad for a company that sells books online. Maybe this Jeff Bezos guy has got a head for business. I think
He's
that I might
on
be,
something, not Jeff Bezos.
yeah, I might be ahead of the curve, and maybe it's a little too early for that hot take, but I'm willing to put my neck out there and say that I think he's probably got his eyes on the right prize here.
Seems like. All right. Well, Corey, any other thoughts you want to drop on us before we wrap it up?
Nick, I just would like to say that happy to be back here, happy to be back in the swing of things. I did make it into the office today, which is why this podcast isn't plagued with knocks on the door or crying babies in the background. But I'm excited to be back on the schedule for this year and looking forward to more topics to discuss as we come in. And as always, it's a pleasure getting to catch up with you, because we just don't get to do it frequently. So I appreciate the time, and I think that's all I have to say on this one. I would say another successful version of the Nick and Corey Empowering Plans podcast. That's how I would wrap that up.
I wholeheartedly agree. Thanks, Corey. It was good talking to you today, bud. I'm happy for you and your twins. I hope your wife's not going too crazy. You sound like you're handling it pretty well so far. Thank you, man. It was a pleasure talking to you. And thank you to Pat Santos, our producer extraordinaire. Couldn't do it without you, bud. Thanks, everyone. This was, again, the FIA Group Empowering Plans podcast. We'll talk to you again next time. Have a great day.